Flashcard Friday. So today we're going to cover our ENT section of the Weber and Rinne and Sensorineural and Conductive hearing loss. As you know that we've been studying that this week, so let's get into our flashcards. All right, the first one says neural deficits or inner ear abnormalities. The Rinne results is an A. Weber result, the sound lateralizes to the unaffected ear. So what do you think this is? Sensorineural hearing loss. You know that sensorineural is a neural deficit or inner ear issue. It can be like Meniere's or things like aging neural changes like presbycusis, genetic factors, or being surrounded by chronic loud sounds that have affected the ear. Also, so the Weber exam, it will lateralize, being abnormal, but it will lateralize to the unaffected ear, so the ear they are not complaining about, okay? All right, next. Something is blocking the conduction of sound to the middle or outer ear. With the Rinne results, the bone conduction is greater than the ear conduction, and then with the Weber results, the sound lateralizes to the affected ear. So this one will be conductive hearing loss, right? Because we know that something is blocking those sound waves to the middle or outer ear portion. So it can be cerumen, it can be something actually in the ear, a pebble or anything blocking that sound wave. And you know that the normal finding for Rinne is that the air conduction should be greater than bone conduction. So AC should be greater than BC, but it's abnormal and positive for conductive hearing loss if the bone conduction is greater than the air conduction, and then the sound on the Weber exam will lateralize to the affected ear, so the one that the person is complaining about. All right, so tuning fork is struck and placed in the center of the patient's forehead, and then they should explain which ear the sound is heard best or equally. An abnormal finding will be if the sound lateralizes to either ear. Which test is this? Weber, right? Weber is when we do the tuning fork in the middle of the forehead and ask them which ear do they hear it best. They should hear it equally in both ears. All right, and lastly, the tuning fork is struck and placed on the mastoid bone. Then the tuning fork is placed in front of the ear. A normal finding is AC is greater than BC, being ear conduction is greater than bone conduction. And if there's a conductive hearing loss, the BC will be greater than AC, right? We talked about that, and that is your Rinne exam, okay? All right, you guys, meet me back here for another Flashcard Friday. Share with a colleague or a friend, and make sure you guys are following me and subscribe to my YouTube channel. Bye, y'all.